Can I help you with something?
I just thought somebody was supposed to check my dressing.
Okay, let me take a look there. Yeah, you might need a dressing change. I'll be right back.
Okay.
Hi, Becca.
Hi.
What's up?
I think I need my wound looked at.
Oh, okay. Let me just look at it. Yeah, looks like it needs to be changed. I'll be back.
Okay.
All right, girls, thanks for coming. I just wanted to discuss a few things. I've had a lot of families, and we've had a few patients with MRSA. So I've done some research and come across some data here that I've given you on maybe some ways to prevent. We want to make sure we're trying to improve the quality of their safety and their overall stay while they're here. I don't know if it's just maybe not washing properly or using the hand sanitizer maybe too many times, but maybe if within the next hourly rounds I can come with you and we can kind of just go over a few things if it's okay with the patient. Just make sure we're doing things right. Okay? Okay. All right. I know we do have a patient here right now that has a pretty large wound, so I just want to make sure she stays safe and then any future patients. So we'll just cover a few policies and procedures and how to do things and make sure we're following the protocols. But I've collected the data and we'll kind of just go from there and see how the results happen over time. Okay? Okay.
Cut.
Now, we're just going to go into Becca's room and take a look. She's in room 203. And I'll just go through a few things. I talked to her earlier, and that's okay that we're all in there, just to make sure everything's going okay, all right? Okay. Knock, knock, knock.
Come in.
Hi, Becca. It's Cammie. I'm with Quality Improvement, and these are the nurses. I just wanted to go over a few things like I talked to you earlier. Just make sure they're doing things right. And I know you have a big wound, so we don't want to get you infected with anything. And there's been some data out there that we need to make sure we're washing our hands correctly and using hand sanitizer when appropriate. So, girls, if I can just have you wash your hands, and you want to make sure you wash your hands for about 15 seconds minimum. More is good, and you want to use lots of friction. So if you want to go ahead and wash your hands before we get started looking at that wound.
Okay.
You want to make sure you put some gloves on too. The more friction kills all them germs, and germs cause MRSA when you have an open wound, Becca, so we just want to make sure we're preventing any further infections or hospital stays.
I don't think I will die.
No. So I'm not going to be touching you today, but I'll just go ahead and use some hand sanitizer. And she just needs a dressing change.
Okay.
So you just want to make sure you're gloved and you guys know the procedure. So go ahead and just change it and get the new one on. Okay.